Today, I have the pleasure of introducing Jan Mead. She is a physical therapist and acupuncturist, which is a unique combination of Eastern and Western medicine, also a lot of school. I love talking with her today. She shares a lot of information from her own journey on infertility and how this helped her and how she uses it to help others. But we also talk chronic pain, women's health, and so much more. She has such a unique perspective you're not going to want to miss. Welcome, Jan, to the show. Who's the person you're being? Are you satisfied? Welcome to Be the Person, a podcast for the brave and the curious, for people ready to explore their true potential. I'm your host, Annie Randall. Join me and let's get ready to go on this journey together. Welcome to Be the Person podcast. Today, we are in for such a treat. I have Jan Mead with us, and she is a physical therapist and acupuncturist. She's local in Colorado Springs, and she provides so much value. I cannot wait for you to hear from Jan today. Welcome, Jan, to the podcast.
Thank you so much, Annie.
Yeah, I have the pleasure of meeting you through a mutual friend and then being treated by you. And I think it's really unusual, you tell me, but to be both an acupuncturist and a physical therapist, because both require a lot of school. So
Mhm.
tell me a little bit about that journey of blending Western and Eastern medicine together.
Yeah, so I went to physical therapy school first. I connected with that really early on, and I decided in 8th grade that's what I was wanting to do. Just through my 8th grade science teacher, I learned about the profession, and I just thought, "That sounds perfect for me." And that journey started early on and stuck with me all the way through college, and so I did graduate from PT school, and then I think 5 years out of PT school, I was living in Seattle, Washington, and I just really wanting to know more. I was looking at different specialty areas in physical therapy, um, special techniques, different things that I might be able to add to my practice. And I knew nothing about acupuncture, nothing at all. I never had it. It wasn't even in my thought process at all. But I had this really unusual experience one day when I was just sitting on my bed and it was almost like a voice from outside of me said, "You're going to acupuncture school." And so and it was very literally almost like somebody was sitting there talking to me. It wasn't from my brain because, like I said, I really had not thought about it or even considered it at all. So I it was very direct. And so I told my friend, I'm going to go to acupuncture school. And I researched the schools that were in Seattle, and one of them just seemed to have the best clinical opportunities. And so I signed up. I was signed up for school and enrolled with the next week for the next semester. And my advisor there was like, "Well, maybe you should consider getting a treatment." And so I was like, "Yeah, that'd probably be a really good idea." But I did have a treatment, and I had just gotten back from relatively soon from a trip to Asia. I had traveled to India, Nepal, and Indonesia, just did like a 2-month trip. And uh, I was having some issues from one of the drugs that I received for malaria, one of the preventive ones, and which was like panic attacks and things like that. It was pretty severe because I went to the emergency room a few times with that. And I had one treatment and I never had any problems with that again. And so that was just, I knew I was going to go because I just didn't doubt what I heard. It was a pretty strong directive. But that was just confirmation for me. I was like, "Oh, wow, this is really powerful medicine." And so, yeah, and I truly enjoyed my studies, even though I was going back to school and I worked my way through school. I enjoyed every minute of it because I loved it. I loved the information and just like sponged it up and was very excited about it. So,
Tell us a little bit about your practice today because you combine both. And I know that you treat a lot of different types of people, but give us some examples and how you combine both therapies.
Yeah, it took me a little while to figure that out. I thought that I was going to drop physical therapy and just do acupuncture only, but was still seeing a lot of musculoskeletal patients and patients with pain, and it seemed silly for me to drop all of those skills and then just to do the acupuncture. But I began just by doing separate, like a PT session and then an acupuncture session. And then I think it was when I connected with my teacher for acupuncture, Dr. Tan, who just got amazing results for pain, musculoskeletal pain, as well as other things. But it was almost like miraculous for me because I was like acupuncture for me, as I was taught, it worked sometimes, and then sometimes it just didn't seem to work at all until I met Dr. Tan. And then that was a game changer because amazing results, super consistent. And the methods that he taught allowed me to do myofascial release while I have the needles in because it's all distal and not local. I began experimenting with that and then just started to get really incredible results. And so I just have taken that and refined it and developed it a little bit more. Primarily, I treat chronic pain, chronic multiple, like really challenging conditions is seems to be my specialty. Those people who have tried everything, but nothing has worked. And I think it's just the combination of things and the layers of treatment enables that group of folks to be successful, which is great. And then I also treat women's health patients for fertility, postpartum, and pre and post pregnancy, during pregnancy, anything women's health related, actually. And those are the two primary, but I do treat other things, neurologic things, Bell's palsy, some other neurologic issues and things like that.
And I'm excited because I'm a patient for chronic pain. So excited to see I'm on my second treatment. I ended up there too of trying a lot of different things, and I'm excited for that.
Yeah.
I knew a little bit about acupuncture, but not a lot. Can you tell me like a little bit about the philosophy behind it? I know that you put needles in, like you said, not in the direct pain points, but different areas in the body. I think
Mhm.
people hear a lot about acupuncture, but they don't necessarily know a lot about it.
Right, right. Yeah. It's a completely different form of medicine than Western medicine. The language is different, was developed thousands of years prior to Western medicine. And so a lot of it was figured out via observation, really deep observation of how our environment affects the physical body and how the emotional, mental, and physical body are all connected. And there are always issues on all levels with every condition. And so I think that was the brilliance of Chinese medicine, is being able to connect all of those elements together. And so it's really nice to have that background, I think, just in evaluating patients, because there's a lot of deeper understanding of all the layers of things that may be contributing versus just the simple physical issues. Um, but it's based on a 5-element system and very much based on how everything is connected together. And it gets a bit technical. I mean, there's basically 12 different primary meridians. There's 8 extra meridians in the body that run from head to toe. And in the form of acupuncture that I do now, called the balance method, it gets pretty technical, and it's based on the Bagua and also on actually some structural engineering principles, because Dr. Tan actually came to the United States to study engineering. And so he was an apprentice in acupuncture from the age of like 7 years old in Taiwan, where he grew up. And he was able to layer on some of his knowledge of the acupuncture that he studied his whole life with some of the engineering principles. So he's just a brilliant individual. And so the acupuncture sequences that I use are based off like of a mirroring and imaging in the body. And say for instance that there's like right knee pain, then we would treat the left elbow would be a potential place to put the needles, just for how the meridians in the left elbow balance the meridians in the right knee. And it goes on and on. It becomes a lot more complex than that. But basically, the acupuncture needles are directing circulation into very specifically into the areas that need blood flow. I mean, healing is all about blood flow, getting the blood to the area that needs healing. And so acupuncture is very good at sending the blood there, but then the myofascial release layered on top of that creates space for the blood flow to get into those areas that have been really restricted and perhaps restricted for a very long time. And I think it's the best form of manual therapy to be able to release old restrictions, things that might have been there for quite a long time.
Yeah, super interesting. And it's been interesting to experience it from you of just having the needles and then doing the release and just combining both because usually, again, I believe it's one or the other and very
Mhm.
rarely do combine and have them both done at the same time.
Right. Yeah. I think I've only met one other PT who was actually also an acupuncturist in my career, and I knew of one other. So I know for sure of three of us in the United States. I'm certain there has to be more than that, but that's the only other two that I've ever come across. Yeah, I think that we're pretty rare, or the ability to endure that much schooling.
Yes. And you
Yeah.
have a neat story too, tied to being able to conceive with this, and that's right how you got more into women's
Mhm.
health, and then helping people conceive. Can you tell us a little bit about that?
Yeah, so I studied with John Barnes for the myofascial release for many years, and during that time frame when I was doing a lot of intensive study with him, I had my daughter, and then a couple years after that I had an ectopic pregnancy, which led to an emergency surgery, and one of my fallopian tubes needed to be removed. And after that, it just was very challenging to conceive again. And I was also, we'd had my daughter when I was 35. And so, in the midst of all of that, 2 years later, and then not being able to conceive, I was into my 40s. And it's like, well, then maybe we'll just have one child. But I really felt this like, no, there is another member of our family. I just know it. I mean, in my mind, logically, I was very happy to have just one child, but just felt this energy of this other being that really needed to be in our family. So I was just like, I felt this like little bit of tug of war, but I went to study with John for a week, which I would do periodically, where I would go and I would treat patients with him and get treated by him. And so we did, just based off of the surgery and some of the scar tissue there. And we did some women's health, pelvic floor, scar release things. Just a couple of sessions of that focused on that during that week. And the very next month that I returned from that, I got pregnant with my second child, gave birth to a healthy child at 43, which is now 13 and in middle school. Just such a blessing and definitely a bright light, and really just has completed our family in the most perfect way. So that really is so inspiring to me. I was just like, wow, this is amazing work. And I just really want to do all the training there so I could help other women in any way that I can. So that's been really rewarding.
I love that. And you take your personal journey and you turn it to help other people because you've had a lot of success, right, in this area of helping women who haven't been able to conceive actually conceive.
Yeah, yeah, that's been super rewarding to help other women through that journey because I know how hard it is. I mean, for 6 years, it's just brutal. Every month you're thinking about it and there's this desire for it and it's not happening and you're trying this and trying that and it can just be very emotionally exhausting. And yeah, to just know that and be able to support that, I think has been really helpful for other women. But yeah, it's and women come from different sources, women who are receiving IVF and want acupuncture support, or women who want to try natural supports without IVF, or they've tried IVF and it wasn't successful and want to try the natural route. So there's all different sorts of scenarios can be supported with both the myofascial release and the acupuncture. Yeah.
I love that because when I heard of that, I just know there's a lot of people listening that either have a friend, themselves are going through it, know somebody that, and this isn't like a common thing, but if you're in that journey, it can be a long journey and it can be such a hard journey, like you said. And to have another option where there's hope and there's really great results, I wanted to just get that out and share with our
Mhm.
listeners.
Yeah, and actually statistically, there in research studies, the combination of acupuncture and herbs actually has a higher success rate than IVF does. And I don't think many people know that, but their success rate is higher
Wow.
by quite a bit. Yeah, by at
And
least 25%. So,
okay, very good.
yeah.
If you work with somebody, how long? You said you went for a week. I'm thinking, okay, we're going to hit up some local Colorado Springs, Denver people that are close by to you, but
Mhm.
also the people listening that aren't in the area that may want to see you. How long do they typically work with you, or what do those sessions look like?
Yeah, so it depends. I do treat people from out of state or out of the area that come in for intensives. And those might look like 2 sessions a day, maybe spread out, a morning session and afternoon session for a whole week, which might end up being 10 sessions in a week or 1 session a day, depending on the tolerance of the person, depending on the background, depending on the goals of the session. Weekend intensives I will do occasionally for people who are a little bit nearby, maybe just coming from Denver or coming from the West Side or something, and doing maybe 4 sessions over a week. It really, or if somebody's coming from Denver, still a lot of progress can be made doing 1 time a week sessions. It might take a little bit longer to gain traction if it's a chronic problem, but certainly what I like to do is determine what supports and things that are going to be really critical and specific that are going to make the most difference for them to do at home, either that where it'd be supporting with herbs or doing very specific exercises, not like 10 things, but maybe like 2 things that are the keys, the most important keys to making the most progress and really focusing on those. I find that the compliance and the ability to do that is and the success rate of what you're doing at home is much more successful if you can boil it down to the couple of things that are going to make the most difference for consistency. And so, really, those sessions are based on location, availability, schedule, all of those things. Diagnosis are just individually tailored, so it can look many different ways.
I have a special trip that I want to invite you on. Jeff and I are hosting a trip to Peru next year. It is September 26th through October 4th. We start out in Lima with a day tour, then fly into the Amazon jungle, tour there for a few days, fly over to Cusco, where we tour the Sacred Valley, the salt mines, and then do a 1-day hike to Machu Picchu. If you've ever wanted to see Machu Picchu, now is the time because it's getting more and more restricted. After that, we go back and have the option to hike Rainbow Mountain the next day before we leave Peru. It's going to be such an amazing, fun trip. What I always love about these trips is the community that they form. If you're interested, the link is in the show notes. I love that
And
there's flexibility there too, because everybody's life is different and depending on where they're at and where they're at in the
Mhm.
journey, that you're flexible to work with them.
Right, yeah, and I think people say, "Well, I don't think I'd be able to go enough to make progress," but with this style of treatment, with the acupuncture and the myofascial release combined with I also do that one other modality, the myokinesthetic system, which is working on the level of the nervous system. So all 3 of those things combined are very potent, and yeah, frequency, you can still make a lot of progress even if you're only able to come a few times a month. So I've seen it just over time. People are holding results a lot more from session to session. So I don't see a lot of backslide. I see progress made and holding there, and then next session, progress made and then holding there. So yeah, it's good.
So, is there one success story in particular that comes to mind that you've had with infertility?
Oh gosh. Yeah, there's been quite a few, but I think the one that I think is just near and dear to me because her story was so much the same as mine. Because she had been that she and her husband had their first child and then had a pretty traumatic birthing experience, and there's just trauma in her body from that experience. It ended up in an emergency C-section, and I think she came to me for something else, and then we ended up talking about the potential of the fertility, and she's like, "Oh, yeah, I didn't even know." And so we worked a little bit on the scar area, did some women's health therapy, and within a month, she got pregnant. And she had gotten pregnant like several she had like I think 6 miscarriages. And so we continued to work with the pregnancy for about a month afterwards, with supports for acupuncture, just preventing miscarriage. And she ended up having a beautiful, healthy little girl and still sends me family photos every year. And it's great.
Mm, I love that.
Yeah. Yeah.
I know you do a lot with women's health to pre and post pregnancy. And my kiddos they're a little bit older, like almost 20. And so that wasn't a thing after pregnancy when I was going through it. But I think much more so it is now.
Yeah.
Tell me a little bit about that and because I know there's a lot of women that have had kids that listen and they may be like me in the journey, or they may be just having kids and just knowing what the options are.
Yeah. I'm still surprised at how far behind we are in our medical system of women getting appropriate postnatal care. In all European countries, that is just standard part of care is all women get physical therapy after giving birth. I know in France it's like 4 months. I believe in Germany it's like 4 to 6 months. Sweden, it's 4 to 6 months, and it's just surprising to me, even as women's health gets to be more known by more women, I'm just surprised that it's just not a normal standard of care yet, but should be.
Yeah.
So, there's so much that happens in the body during pregnancy on many levels, not just certainly on a musculoskeletal level because all the your core muscles are completely stretched out and your hips get wonky because depending on how the baby is sitting, and then plus the trauma in the perineum and pelvic floor through the birthing process, many women having tearing and things like that, and diastasis recti and incontinence issues afterwards. And it's not standard, even when there are issues, to be referred for physical therapy. More and more now, which I'm very thankful for. But some women that I see are just self-referred because they're having problems afterwards, and that they thought maybe would eventually go away, or women who come to see me for other things and think, well, just I'm having a little bit of leakage or stress incontinence, like when I jump or try to go jogging, I can't run anymore because I'll have a little urine leakage. It's like that is just not normal. It is not normal. It's common, but it is not normal and so easy to take care of. Just want women to really know, even if it's been 10, 20 years, you can still improve it. It's a muscular weakness, something that's happened in the pelvic floor from birth, and those muscles just have not been reconditioned afterwards. The bladder itself is a muscle. There's muscle in between the bladder and the vaginal canal, and so much that can be improved. I think of a woman that I just completed her therapy, had 3 kids, was not able to do some of the exercises in her exercise class because she would have urine liquid leakage or just be used to having it and having to change everything after working out and being afraid to cough or sneeze or laugh in public, and then also urinary frequency. I think that's another thing that women may not think of as a part of a weakness in the pelvic floor, but she was like having to go to the bathroom like 6 to 8 times before she could finally settle to go to sleep, and then waking up in the middle of the night like 4 more times to have to go to the bathroom. After 2 months, like not like maybe having to go to the bathroom twice before bed, sleeping through the night, no stress incontinence, able to do all the exercise she wants to without any leakage. And that's just after 2 months of treatment, after having 3 kids. And she was just like, I had no idea it would be this easy. She's like, I just wasn't even thinking. She was like, I think I was happy to get even 20% better, but completely all goals met. And that's very common across the board. Yeah, I just encourage women to seek out that help. And even if you're not having symptoms, say after giving birth, it's a lot of trauma to the pelvic floor. There can be issues lurking afterwards that might not show up for a couple of years afterwards, like low back pain, sciatica, uh, incontinence issues might show up a couple of years later and just progressively get worse. So it may not show up right away, but coming in 3 months after, 2 to 3 months after giving birth and just having a check and evaluation to see what's going on is highly advised.
Yeah. I love that you do that and you talk about and just educate women that it's common, but it's not normal. Like, I think that statement is really significant because I know it just talking with a lot of my girlfriends, like, it is very common. But, for me, even before we talked and had conversations, it was like, I didn't really know that there was a lot of different treatment for it. So just learning from you, I think has been really eye opening.
Yeah. Yeah. Yes. And I think that, yeah, I see women years later who end up having, and I would say definitely athletic, who end up having issues like around the lumbopelvic area in doing sports or doing this or doing that. And that can be drawn back or traced back to not having specific postpartum care. Just if there's pelvic floor weakness, there's going to be hip weakness, things that may not be identified or no symptomology at the time after giving birth, but are there, that injuries later down the road can be prevented just by having some basic physical therapy. Maybe like even just 4 visits. If you're not symptomatic at all, just an evaluation, like 4 visits to make sure everything's back on track and back online and everything, all the muscles are firing properly, the hips are aligned, could prevent a lot of potential issues down the road.
Absolutely.
Mhm.
Yeah, one of the things I love about you is when we first talked, you were telling me all these things, these hiking trips, skiing trips, like you do a lot. You're super fit and you don't seem to slow down at all as you're getting older. In fact, I think you do more. But I love that because you're a role model for as people age, they don't have to. They can continue to live the life they love. That's a little bit more about you, things you do, philosophy behind aging and continuing. Not that you're old by any means, but again, that you just keep going and doing everything you love.
Yes. Yeah, I think that, I mean, I've always been very athletic and it's just what I love to do, hiking and backpacking and cycling and skiing and running and all the things. And my love of all those things has not diminished, thankfully. And I think when I did the years that I had when my kiddos were younger, and there was a span of almost 8 years, and I probably did more yoga and, like, hiking, and just, like, the intensity decreased a little bit for probably about 10 years, but I was still very consistent. Like, I would do something daily, yoga, 3 to 4 mile walk or jog, and then longer bike trips and hiking and stuff on the weekends. But I would say when we moved back to Colorado, I really got back into doing more intensive stuff, probably because of the friends that I met and talked me into doing like adventure races, and got back into mountain biking because of our proximity to trails and things like that. So the last few years, I've been doing a lot more heavy duty endurance things and long distance backpacking and doing 20-mile days on the trail. And I just feel stronger than ever, really. And yeah, doing 14ers, having that availability here in Colorado, and which I just love it. I think my mindset, like, part of the reason that stimulated my interest in learning more when I was just about ready to enter into acupuncture school is that working with older clients who some very debilitated at a really relatively early age, say in their 60s or early 70s, versus being out on the trails in Washington state and seeing a 90-year-old couple, both in their 90s, like going for a 6 mile hike on Mount Rainier. So that to me has stuck in my brain. I'm like, that is going to be me. I'm going to be the 90-year-old hiking on Mount Rainier. Why not? And my diet, the activities I do, folding in meditation, just everything, trying to balance my self-care routine is all focused on longevity in being able to stay active for as long as I choose to. And I've been successful so far. Very minimal injuries. Well, I've had some significant mountain biking injuries, I have to say, over the last couple of years, uh but I recovered from those just fine, which is another testament to just being pretty strong in my body and understanding how to rehab that properly. But yeah, I'm just excited to do more and plan more, and planning some through hikes in the next couple of years. Yeah, just keep moving. That's what the
Yeah.
body is designed to do.
I love that mindset of you're going to be hiking at age 90 and doing all the things because I do think it's a big mindset. And then obviously the physical has to follow, but to both of those combined.
Yeah, and I do appreciate here because I think in Colorado there's a lot of really great. Any day that I go out on the trail, there is all ages, folks in their 70s and 80s on the trail climbing 14ers. I mean, I think it's very inspiring. I think there's a lot of people with that same mindset in this state. And that I think that helps to lift us all up into knowing what we can do. Yeah. And on my Facebook feed, I join like groups for the master's track people who are in their 90s, or the 101-year-old gal who just set the world record for the 50-meter run or whatever. It's just, I try to feed my brain with those types of examples, and I think that helps.
Absolutely. I'd love to wrap up with people's 1 to 2 favorite books because it's always, I love hearing people's answer on this question. And it always gives me a long list of books to read. So, how would you answer that?
Oh my gosh. Okay. I tend to read, I have not read very many fiction books. I read a lot of like spiritual minded text and text on consciousness and things like that. I think my very favorite one is by Ernest Holmes, and it's called this thing called You. And it's just one of those that you can just open up and read a passage. It has some very affirmative statements in there. And I feel like for me, it's very empowering. It's a really good guide for my day. I try to read a passage from it the very first thing in the morning and the very last thing at night. And so that one is primary on my bedside. Let's see. Uh, Two. I think you did tell me these before, but I don't know if I can come up with another one. That's
Well,
like
one
my
to
opposite
two.
favorite.
That one's perfect, and I can link to that in the show notes.
Yes. Yeah.
What about
I
best
think
way to connect with you?
yeah, so probably through my website, sacredpathwaysintegratedhealth.com. It has all the contact information, email, phone number. Texting is fine, calling is fine, leaving a message. I am oftentimes treating patients and yeah, messaging, email. I check multiple times a day. So typically I'm able to get back to people same day. Yeah, that would be my best suggestion is going to the website. And then there's also a lot of information there as well.
Okay, awesome. And I'll make sure I link to that in our show notes. If you guys have been listening and there's somebody that you know of that's one struggling to get pregnant or even after pregnancy, I think Jan can be such a wonderful resource. And I would just ask you to share this with them because even when I was talking with Jan, I was like, oh my gosh, we definitely have to do a podcast about women's health and about this because I really do think you're just you're so unique in such a great way that I want to share your gifts with more people. So I really appreciate you being on today.
Oh, well, I thank you so much for having me. I love to get the word out as much as possible. I always try to send my patients as little disciples out to their friends and groups to be like, tell your friends, let everybody know. So,
Absolutely.
yes. Yes.
Well, thank you all for joining in to Be the Person podcast. I truly appreciate you listening. And always, it would mean the world if you gave us a 5-star review. Thanks for tuning in today.